there is that
There's a process that you go through.
When I first lost my hand, I wanted a right hand. And I noticed today, it's the first time I've seen Ruth in like 6 years, she walked in and she's not wearing a prosthetic arm, and neither am I. And I don't wear one anymore. But when I first lost it, I wanted a hand. And I ended up with a myoelectric hand, and it was great. And I wore it every day to work. Didn't matter what I was doing. If I was out of bed, I had on my arm. And I needed it, mentally and physically. It's a tool, and I used it all the time. Over time, I have since found out that I don't have to wear it constantly, and I actually no longer wear it to work every day, and I get by without it. You use the term workaround. You adapt. You do.
Yeah, and I was on crutches for 14 months, and I know what that's like, and that's very livable. I could get into any restaurant, around any chairs, go up steps. It's amazing how adaptable humans can be, no matter what your situation, because we're all different. We all have different experiences and problems and feelings. But I put my leg on, and I'm lucky enough that it works. But for 14 months, it didn't work. I had to face the fact that maybe I wouldn't be able to have a prosthetic because the bones would never heal. And attitude isn't something you have. It isn't something I had right away, and I can't speak for you two, but it took me a good solid year to be able to really laugh and joke about it and to be completely 100% okay with it. But there is a lot of grieving that goes on, and I still have those days where if I'm wearing shorts, I'll go to the mall and I think that everybody's looking at me, and it bothers me.
Yeah.
It used to bother me all the time, but now I wear it as it's a badge of honor for me. I went through something very difficult. I had a year of chemo. I fought for my life, and I fought for my leg. I didn't win the battle with my leg, but I'm alive, 3 years out now, and that's where my attitude is. It took a while to get here, but it gets there eventually.
Steve, you were talking a minute ago about you didn't quite know what was going to happen, you know. And can you talk a little bit about what it was like during that period of uncertainty? You know, I assume it was a bit like an emotional roller coaster, days that you were optimistic that things would go well, and days that it felt like nothing was going well. What was your experience like?
Well, Dr. Cheng is the doctor here who did the surgery, and he told me that I would never walk again without crutches, meaning that he was going to do a complete hip disarticulation. But he put me in traction, like I said. So I laid there from April until August, staring at my leg that I knew wouldn't be there. I was fighting for it, but mentally I had to wake up every morning, and that's the first thing you see. And I had to wrap my head around, my thoughts around the fact that it's going to be gone, and what's going to happen, I don't know, but here are the possibilities, so that I'm prepared. If they do a disarticulation, I'm prepared for that. That they have great devices for that now. If they're going to do a limb salvage surgery, best case scenario for me, I'm prepared for that. But I'm prepared for it was all about education and asking the doctors every question I had and making sure that if I didn't understand their answer, I asked it in a different way, and they kept on answering questions, and I kept on asking them, and eventually knowledge is power, and I felt better about everything that was going on because it was happening and I couldn't stop it. I couldn't control what was going on, but I could control how I was acting and what was going to happen after the fact, how I was going to deal with that, and how I was going to live the rest of my life.
So you were preparing to live for the rest of your life and sort of marshaling those resources within yourself to figure out, if I can get through today, I can get through tomorrow.
Looking towards the future, like I said, 100% all the time. If you have something to look forward to, you're not stuck in what's happening today. If you're going through chemo and you're sick and you don't have any hair, there's always next week when it starts to come back after treatments.
And I think one of the challenges with a cancer diagnosis, my cancer diagnosis, and I can only assume that it would be the same for Steve and Steve, is that you get this diagnosis and then, boom, you're in treatment. I mean, you know, boom, you go one day for the test on your heart, and, you know, 3 days later you're getting the port implanted in your chest, and then you're going into chemotherapy, and it's just like, you know, boom, boom, boom. So you get inundated in it so fast in terms of the treatment phase, and then really you don't have the time. I didn't have the time to think about, what is this really, and until I had to focus on it. I had to focus on it because of the reality of the fact that I was losing my hand. But I agree with you completely, Steve, that I felt it was my responsibility to educate myself and to ask questions and to be a knowledgeable patient when it came to participating in my treatment. I thought that was my job.
It is like
I
having a
also
job.
believe in self-advocating. I sought out knowledge. My employer let me use the computer at work and did a lot of research online for my type of cancer and information that I wanted. Knowledge is power. You said that a few minutes ago, and you've got to understand what you're facing, I guess, to be comfortable with it. And different people learn in different manners, but you've got to get a hold of it however you deal with it. And you have to be comfortable with yourself in the long run. So we're all different, but we've all adapted to our challenges.
So, as you were going through this, you were probably thinking about how life was going to be different. Has it been as different as you expected it to be? What's been different? What's been more similar?